Welcome to the Help Me I'm Middle-Aged podcast. My name is Rob.
And I'm Rob, too.
And today we're here with Dr. Jonathan Wierzbicki. How are you there, John?
I'm doing good. How you guys doing?
Good. And this is our first podcast where a specific topic of the conversation. And today it is on sleep. Gigantic issue in the middle-aged demographic.
Very.
A lot of friends and family have a lot of problems with sleeping. And John was kind enough, Dr. Wierzbicki was kind enough to come on and help educate our listeners and talk about it. Thank you so much for coming on, John.
Yeah, thanks, John.
Oh, absolutely. My pleasure.
So we want to start with just basic stuff like is this something that we didn't realize when we were younger was happening because we slept fine?
Right.
And now we're just at that age and we're all going through it. You know, Rob here
Yeah.
has a lot of problems sleeping and he's going to talk a lot about it. But it's just something we're realizing because we're getting to that age and a lot of our peers have it.
So just a couple things. So we do sleep less naturally as we get older. Our sleep need goes down just as our metabolism goes down. And as we kind of delve into things, we'll talk about what we mean by metabolism and how sleep affects that. So your sleep need does go down. There is a couple of factors, though, that when people say, so just to give a couple numbers on this, you know, insomnia is something that is very, very common. You're talking about even a majority of people that have it, but people with chronic insomnia, where it's actually a medical condition, they're estimating 10 to 15% of adults. So that's a big, you know, think about different.
That's huge.
Yeah.
That's how many people actually have it, you know, at that point, 1 in 6 people. So there's a couple theories as to why that's happening. One is our use of devices like phones and such, televisions, also stress level, the pace that we're at.
That blue light thing they talk about, what is that light thing they talk about?
Yeah. So, you know, our circadian rhythm, which, again, we could talk a little bit more as we talk about the physiology of sleep, is greatly affected by these. You know, when you think about late at night, what do you typically do? You watch television.
You're on your phone.
You're on your phone checking things. Light in particular is a huge factor when it comes to sleep. So because of kind of the lifestyle that we have now in 2020, it really does affect the quality of our sleep for sure.
Absolutely.
Is there like a certain age where the condition of insomnia becomes more prevalent for people?
Usually you're talking, you know, just as a general number, probably like 40s and up.
Right.
Unless you're talking about when you start talking about secondary causes, like a lot of people think of the insomnia as their main issue, but there's really a secondary cause, like, for instance, a mood disorder like anxiety or depression or obstructive sleep apnea. So that's, you know, usually around 40s or so would be like a time where insomnia tends to be more of an issue, for sure.
And the reason I bring that up is because about this time last year, I was turning 50, and my oldest son was going off to college, and it started to manifest itself in me having trouble thinking I've got to fall asleep quickly, because I usually am the one who falls asleep first in the bed, and then my wife comes in, and I was like, I got to fall asleep before she gets in, because if she comes in and I'm not asleep, just her very fact of coming into the bed might wake me up, and then you start thinking over and over and over and over, and it's like then it gets very frustrating. So,
Absolutely.
Yeah, so that's been with me for like the last year. I wouldn't say it's like devastating me, but it's certainly still something I don't think I have had a conquest of it. You know.
Sure. It's interesting. When I was a resident, we typically were woken multiple times during the night.
Sure.
You know, for any variety of things where you're up and you're dealing with things, so you're fully awake.
Those long shifts too, right?
Yeah, we'd say they don't even do this anymore. We used to have 36-hour shifts in the hospital. So we sometimes would have 2 or 3 hours of sleep. And listen, you're tired when you're doing that, and it affects your judgment and everything else, but you were able to kind of handle it. I think now I would never be able to do that. Yeah. I would never be able to stay up for that length of time. And like you're saying, like now, let's say I get woken up, I get paged a couple of times, and I have 3 hours before I have to get up. I feel that pressure.
Yeah.
Like, okay, I have to sleep now. If I sleep right now, I'll get 2.5 hours sleep. So it does play a factor in that for sure. That's almost like that secondary cause of like a situational anxiety that's keeping you up. Yep.
Yeah, and the long-term effects on people, because I was listening to some other podcasts and some doctors talk, and the long-term effects on people who have interrupted sleep, who don't get in that deep sleep. Like they were saying things like, your brain does a tremendous amount of work when we're sleeping. Can you elaborate on that a little bit?
Sure. Actually, if we want to even take a little step back as to why we
let's start at
sleep.
the beginning.
And then kind of bring us in.
Yeah.
So, this is actually a topic even among scientists, like what the purpose of sleep is. And, there's some controversy. So one of the things they talked about is like when you want to find out what does like vitamin C do? What does vitamin D do? So you deprive people of it and see what happens. So you deprive people of vitamin C, people get scurvy. You deprive them of vitamin D, you get rickets. All right. So what happens if you deprive somebody of sleep? What happens? The most famous example of this, it's not a study, but it's actually a good case example, are DJs back in the 50s used to go on these marathons for days at a time where they wouldn't sleep. The most I'd heard about was like 8 days.
DJs as in like radio guys?
Yes.
Oh, okay.
They'd be like, I'm on the air for,
Oh, right.
I'll be on the air all week, kind of thing.
Okay.
So it's interesting. So what first would happen is, of course, you get fatigue. Cognitively, you're a little slower. Your reflex time is down. You guys have probably seen that, the effects of alcohol on driving is very similar to someone who's sleep deprived because your reaction time gets less, okay? So the next thing that starts to happen is you start getting paranoid. You start having some hallucinations. And then after that, you actually start getting into just frank like delusions and psychosis. So, and what would happen is if someone went to sleep and say, okay, it's been 8 days, you're really mentally not handling this well, so I'm going to let you sleep. You actually don't get full recovery. There's some long-term effects of it.
Oof.
The other thing to look at is when you say, okay, so we understand people, but what about in the animal kingdom? Do all animals sleep? And the truth is that some don't. There's some very famous examples, like, for instance, a bullfrog almost never sleeps, an amphibian. Certain insects don't sleep. How about mammals then? Because we're talking about jellyfish and things like,
Sure.
small things. But how about mammals? Well, if you look at a baby dolphin, they rarely sleep either. Giraffes don't sleep much, neither do deer. They require very little sleep. And also, if you think from an evolutionary standpoint, if you had a choice between an animal that slept and didn't sleep, you would think the animal that didn't sleep actually has an advantage because when you're sleeping, you're very vulnerable. And yet, for most of the animal kingdom, those are the exceptions, most of the animal kingdom, sleep is a necessary part of their system. It's almost like for a complex organism and a complex brain, you need to have this. It's interesting, if you look at your energy output, 20% of your energy output is from your brain.
Yes.
Which
I've
is
heard that.
which is very strange to think about when you run and your heart pumping all the time, eye movements, walking around, all the stuff we do, that a fifth of your energy usage
Comes from your brain.
comes from your brain. And a point that you brought up was very interesting, that some parts of your brain are actually not very active at all until you are asleep. Specifically in the second part of the non-REM sleep is when this occurs. So we can talk a little. I just want to segue to some physiology, some very basic physiology of sleep, and then we'll get into what you're referring to. There's two main categories of sleep: non-REM. REM means rapid eye movement, and of course the rapid eye movement type of sleep. So what typically happens is there's a cycle that you go through. There's 3 NREM sleep. That's a non-REM type sleeping. Stage 1 is one we're probably all kind of familiar with. You're sleeping next to your spouse, and they'll start to twitch a little bit. Okay, what's happening is that you're actually like falling into this first cycle of sleep where you start having, like, some people will have like a little hallucination, like they hear a noise or such, and they can be easily jostled.
Yeah.
Yes. So after you get them, the twitching begins. Stage 2, actually, there's a ramp up of brain activity in certain parts of your brain, and you're kind of entering now, preparing for one of the most important parts of your sleep, which is the third stage of the NREM. This is where the deep sleep cycle occurs. Your brainwave activity starts to go down, becomes very slow. Your metabolism goes down. Your body temperature goes down as well. And this is the restorative part of your sleep. This is where healing occurs. This is where your fingernails grow, your hair grows.
Really?
This is where cell repair occurs.
Which is huge.
Which is huge. As he's talking about, like, intermittent fasting.
Right.
Is another part. So this is another area that occurs. The other thing is that, like, when we talk about energy usage, you probably remember this from biology class, ATP, adenosine triphosphate. That's kind of like the currency of your body for energy usage. Well, as time goes on, as you're awake, and your body is going through what's called aerobic energy usage, you're using oxygen. Oxygen is actually kind of a free radical. It actually damages cells. When you start getting into this non-REM type 3, stage 3, you actually get into anaerobic sleep, where you start then to produce more ATP, clearing the adenosine out that's been accumulating all through the day, the waste products of your metabolism. and glycogen levels increase. That's a storage for like your sugar that's in your muscles and such also occurs in your brain. Once you've gone through that cycle, you then start going backwards. You then go to the second stage again. And before you go back to stage 1, you go into REM sleep. This is where you get the rapid eye movements, where dreaming occurs. This is where that paralysis occurs, where like if you feel like you're running,
Right.
you're not actually running.
Yeah,
you're actually
yeah.
like, so it feels like you're like going through like quicksand as you're through water as you're trying to run because you can't really move too well. Once you go through that, you then go back to stage 1, to stage 2, to stage 3, to 2, to 1. It keeps going through that, all
That
through
cycle.
the night.
How many
Exactly.
Is there like a number of cycles
Yes.
you go through?
So each one is about 90 minutes.
Okay.
4 to 6 times a night you go through these cycles.
Okay.
Most of the time when you awake, naturally, it's going to occur during the cycle when it's through an REM sleep, which the REM increases as the night goes on, and your deep sleep in the stage 3 goes actually down as the night goes on. What's interesting, though, is that there's a hormone called prolactin, which you guys are probably familiar with breastfeeding mothers.
Right.
But, men and women both produce it, women more than men. But there's an increase of this as the day goes on. And in a lot of ways, when you think about this, it's almost like this buildup of this hormone, because a lot of this is hormonally related, not just neurotransmitter, but hormonal. That this hormone, as it increases, is telling your body, okay, I need to sleep.
Yeah.
It's getting time to sleep. So the first stage of your sleeping, that prolactin level really begins to go up. And by the second or third time through the cycle, it finally begins to come down, which is why if you sleep 2 hours, someone wakes you up, you almost feel more tired than if somebody just like you didn't sleep at all.
Yeah.
It's because that prolactin level is actually increased. It's almost like your body is trying to make you stay in that restorative sleep when you're there.
Is that kind of like where they talk about naps for too long, that type of thing, where if you can take a 20-minute nap, it's better than taking like an hour-long nap?
Yes, some interesting science with that. So if you look at siestas, some cultures have
Exactly
that.
what I was going to say.
Not only is there like a physiologic part of that with postprandial, like you eat and then you sleep, but there's actually cardiovascular effects to the tune of like a decrease of like 40% of heart events taking siestas. It's very healthy for you.
Nice.
On the flip side, if you sleep too much, especially if you're over 60, so this is very relevant, obviously,
Sure.
to your topic. Yeah. If you're over 60 and you start sleeping in excess of 8 hours, 10 plus hours a day, what will eventually happen is you'll actually increase 40% with heart-related incidents. Yes.
Wait a second. If you sleep more than 8 hours at that age in life,
Depending on each person, because
say that
remember,
again.
the average person, if you start looking just at average, because every person's a little individual, the average person when they're at the age of 60 is requiring 6 to 7 hours of sleep.
Okay.
So if you actually have hypersomnia, if you're sleeping too much, so I'm using 8 as kind of like a bottom, but for some people, they may be sleeping 4 hours a night, 8 is appropriate. And you start going 9, 10 hours, you'll actually increase cardiovascular risk 40%.
Wow.
It's almost like the Goldilocks. Too
Yeah,
little is bad,
yeah.
too much is bad.
Sure.
Yep.
Wow.
That's crazy. So do you think, like, with all the talk on sleep and all the problems that people are having, was it always with us, or at the advent of where we are with sharing information and new medicine coming on and science, we're just learning more about it, or has something changed in the last 40 or 50 years?
I think life is more complicated. This alludes to what we were talking about before. The use of devices, the televisions, and especially the phones. And the fact that life is people say life is stressful. Life is
Right.
It is. It's hard. You have to work hard with our families. We're taking the kids everywhere. So there's a lot of factors like that I think that making sleep much more difficult.
Some people work in shift work.
Yeah, exactly. Oh, yeah, absolutely. Yeah.
No, it's just wherever you go, you hear about like I have 2 relatives that they're on the sleep apnea machine, and I think it sounds like for someone who's not on that machine, like how could you sleep? But it really helps a lot of people. You as a physician have diagnosed it or have seen it all the time.
Absolutely. It's something that's even underdiagnosed because, I'm tired. Everyone says, I'm tired. Not thinking about, especially with men, that, just what I just talked about, if you interrupt your sleep, you actually feel more tired as a result of that. You have to go through this 90-minute cycle. Well, what happens if after 30 minutes of sleeping, you lose the tone of your posterior pharynx? You actually get hypoxic because you can't, have air, transferring, and that wakes you up.
Yeah.
Well, you can get woken, dozens of times a night. Well, if you're not going through those cycles, you're not getting restorative sleep. Bad for your heart, increases the what they call pulmonary hypertension and hypertension in general. and actually has a greatly increased heart attack risk. So, and the fact that you have this risk of if you're not really sleeping properly, you fall asleep at the wheel.
Yeah.
It affects you cognitively. It affects your mood. It's one of the things I noticed even when we were younger as residents. If you didn't get proper sleep, you were on one of these like night shift kind of things for a month.
Shift work.
Your mood would actually be decreased.
Right.
Yes.
It affects you so much, so much. So, Rob, like, if we want to take a case study and talk about you,
that's fine.
How has this affected your life? I mean, have you really found any mood swings? Because when I talk to you, you're like, I didn't get that much sleep last night. So how have you been dealing with this?
It depends. I mean, it runs in like cycles, and I think the biggest concern sometimes will be like, as I was talking with the producers before, basically saying it's around dinner time. And you're kind of already looking forward to how am I going to get to sleep tonight? What's going to be the game plan for tonight? And the anxiety that kind of builds up getting up there. It's not every day, but it's happening enough. And then when you do get that restorative sleep overnight, it's like the most phenomenal thing in the world. Mm-hmm. But I would say there are nights where maybe I'll get like 2 or 3 hours of solid sleep, and it affects the next day. The positive thing from that I've seen is I'm so tired by the next day that the next night is a good sleep.
So it's one bad, one good?
Yeah, and it's situational. I think depending upon what's happening in the world, if there's a lot of stress happening like at work or just in general, things that I have to do, it'll affect it. It's really hard to pin down and say, okay, well, this week I'm going to map out and this is what I got going, and I can expect a tough night's sleep then, a tough night's sleep then. But for the most part, I would say it's kind of a crapshoot in some cases.
So this is what you hear from a lot of patients.
Absolutely.
Yeah.
So if you don't mind me asking a few questions back to you specifically.
Please do.
So before we talk about pharmacology, which of course they go to the doctor, you talk about medicines,
Right.
and there's many different ways to skin this particular cat. So we will talk about medicine and how it affects the particular problem in the sleep cycle and how it helps, because they're all a little bit different. Let's talk about sleep habits.
Yes.
So I'll just ask generically, what sleep habits do you have? What things do you do to help you sleep at night?
Right. So the major thing, obviously, is the dark room. I think that's the thing I try to make as dark as possible. Mm-hmm. We have a fan on, not for the air to be blown around, but just as a white noise situation. Sure. That's very helpful.
Studies are very suggestive white noise.
Yeah.
And of course, is great. And also mentioned the light, which do you keep like a night light on, or do you, when you get up to go to the bathroom, do you have do you turn the light on in the bathroom?
No.
Good. So you're
try to keep it all dark
as much as possible. Good.
Yeah, I'm usually the first one to sleep though. Okay. So what happens is sometimes outside the door, kids are taking a shower, doing something that can filter in, and sometimes that could wake me. Mm-hmm. But otherwise, it's pretty dark, and that's good.
Good.
Yeah.
Right. Anything else that you do specifically or don't do to help with sleep?
We don't have a TV in the room.
Okay.
So I like to read before bed, to try to get in that fall asleep type mode. Other than that, if we could keep it cooler in the room, although my wife doesn't like it as cool as I do, that would be another
common problem
benefit, which is fine though. It's not that big of a deal. Other than that, no. I try to keep a consistent going to bed every night at the same time, which sometimes on weekends, poker games can sometimes throw that off.
How much time do you spend in your room when you're not sleeping?
Pretty much zero.
Zero. Good.
Yeah.
Okay.
Yeah.
When you have trouble sleeping, so let's say you sleep 2 or 3 hours and you get up. Yeah. Okay. How much time do you spend before you try to change where you're sleeping?
I'll probably I'll go to another room if need be. Is that what you're saying? Mm-hmm. Yeah. I'll probably just say, okay, this is not happening. I'm out of here.
Okay.
Not try to fight it. Not try to roll over. We keep the clock not observable because
because that'll be anxiety provoking.
Exactly.
Right.
Oh my gosh.
Oh my God. I gotta
sleep.
Gotta
fall asleep.
Right.
So,
That's a good idea. That's a really good.
Yeah.
That's a really good idea.
We actually have a regular clock, and we'll just put this cloth over it so we can't see it. So,
do you ever do any kind of self hypnosis or anything with your breathing rhythm? Because that's a natural rhythm we all have that we can tap into, actually.
Yeah, occasionally I'll do that. I'll try to take 10 slow, deep breaths and then hold it and then let it out at a certain cadence, if you will. But not too often. I mean, people have said, well, what about meditation and things like that? haven't gotten there yet.
So one little kind of like self-hypnotic kind of thing that we use as actors actually, because you can imagine before a show we're all kind of like
Tense
ready
up.
to go,
Right,
and
right.
or let's say you had a terrible day at work, but you got to go on and you got to do the play.
Yeah.
So you lay down, you close your eyes, we put our arms in a position and such, but you naturally have a breathing rhythm to you that will occur completely without your control. The medulla just kind of lets the breathing occur. So sometimes without trying to breathe, just being cognizant of that breathing up and down has a self-hypnotic effect and very relaxing. Just another little thing to
Sure.
think about to reduce anxiety level.
Yeah.
Okay. It sounds like you're doing a lot of the right things.
I hope so,
And I'm
yeah.
sure you've been working with this problem for a long time. That's not an accident
Yeah.
that you're familiar with some of the pitfalls that you're avoiding.
Right.
I notice the other thing too is like sometimes when we get older, a lot of us, I haven't gotten there yet, but maybe people in our audience have. You need to use the bathroom more than you used to. Sometimes the older you get, it's like once a night, twice a night, 3 times a night.
Yeah.
So that can break up your sleep too. I mean, like you just get in there and boom, you have to use the restroom.
Yes. That's, there's a lot of symptoms that occur with BPH, benign prostatic hyperplasia, big prostate, basically.
That's what I was going to say, John.
Yeah, there you go. It's okay. Use the term and then bring it to light so we can understand exactly.
We're about educating.
There you go. So, people don't come in talking about a decreased stream typically. They'll talk to someone about urgency, of course, because you don't want to just have to go immediately. But yes, the waking up at night.
Right.
Typically once a night, for guys our age, like that's expected. But some people get up 4, 5, 6 times. Again, you come to this thing like with sleep apnea, where how the hell do you go to 90 minutes?
Right, because you got to go to
Because
the
you have
restroom.
to go. So it disrupts it completely. So yes, then they usually come in. And there's some very good treatments beyond anything, even surgical medicines that are available that can help that.
Okay. So you were saying about pharmacological. So what is that? How does as far as prescribing people medication to help them sleep? How does that all work? Because that's like you hear a lot of stuff about Ambien and the side effects and like people getting up and walking away and sleepwalking. So how have you found that with your patient population?
Sure. So let's talk about first over the counter. Okay?
Sure, absolutely. Start there.
So one of the ones when people talk about over the counter, non-prescription things, well, there is one prescription for this. They talk about melatonin. That's like the big hot topic. So where does that come from? So there's a part of your brain called the suprachiasmatic nucleus, SCN. This controls, as a direct neural contact actually, with the pineal gland. The pineal gland releases melatonin, which then lets you to sleep. Now, unfortunately, what some people will do, this is I almost call it like a pseudoscience. They'll say, all right, so I need melatonin to sleep. So if I take melatonin, I'll sleep better.
Right.
But if you look at the studies, not great. First of all, couple issues. The first is you've got to take it for a period of 2 to 3 months to really increase your melatonin level. And even then, there's this thing called the blood-brain barrier. The brain is a very isolated, very controlled environment. The rest of your body can endure, it's hot, it's cold, my pressure's up, down. The brain wants homeostasis almost at all times. So the effect of melatonin just by taking it is a little bit questionable. There is a product called Roserum. I've prescribed it quite a bit when it first came out because there's some obvious benefits, because there's some downsides to the other pharmacologic things that are more effective, per se. But I have not found a lot of success with it. With treating many, many patients with insomnia, very few that are controlled strictly with Roserum. But, if some people want to try that, you could certainly try melatonin. Some people anecdotally will say they like it, which is fine. So that's, the one thing. The other thing that people talk about is Benadryl.
Yeah.
There's products like Tylenol PM.
Sleep ease.
Yeah.
Sleep ease.
So the stronger an antihistamine is, as far as like allergic reactions. Like if you have an allergic reaction, you take some Benadryl. You don't take Claritin. Great drug for allergies, but it's not sedating. In fact, you can actually fly an airplane on Allegra and Claritin. It's actually been approved for those usages, where you wouldn't give somebody Benadryl and then fly an airplane.
Right.
The problem with that, though, is that it does have the histamine in the neurotransmitter. Histamine is not really utilized as much as what's called an antihistamine. That's how it works. But if you look at the studies with that, the going to sleep as opposed to you're just saving a couple of minutes, and as far as the amount of sleep you get is only about 10, 15 minutes total. So it's over the counter. It does help, but it's really a minimal amount. So it's really not that effective per se.
Is there any side effects or long-term issues with Benadryl?
So there's a strong anticholinergic effect. So if anyone has urinary retention or constipation. It can affect it, especially if you're older.
Right.
So you got to be a little careful with that. And the sedation, making you groggy and such, you got to be a little careful with that. But if you're going to sleep, that's obviously mitigated a bit. So those are the typical things that people will use over the counter. Not great. Neither one of those, if you look from a science standpoint, really help out.
Not a home run.
Not a home run. Not a home run. So, the gold standard when it comes to sleep aids is Ambien, Zolpidem. You guys have probably heard of
Yes, we've heard about that.
So there's the regular Ambien, there's a controlled release version of Ambien, and there's an intermediate release called Intermezzo. So Ambien actually affects GABA receptors. That's one of these neurotransmitters at the synapse that affect the nerve. GABA tends to kind of relax nerves. This is like another GABA drug is Neurontin. People talk about that for like neuropathy because it kind of slows the nerve down and suppresses neuropathic pain that you might have. So Ambien has the same effect, but it's got some weird side effects to it.
Yeah.
The biggest one is amnesia.
Oof.
Now, let me explain just how disconcerting this is. Imagine you're trying to go to sleep. You pop an Ambien. It works. You go to sleep a half an hour and you sleep the night. You wake up and you're in your office.
Not your home office.
Yes, you're in your office like at work.
Okay.
So you're like, okay, so I woke up, I showered, I ate breakfast, I drove my car, and now I'm aware that I'm in my office. You acted normal.
Right.
But the part of your brain that the GABA affected is this short-term memory. So even though there's no specific danger, you are yourself when you're doing these topics. That happens to you, you are absolutely freaked out.
Wow.
And if a patient have that happen, they'll be like, I'm never taking that again.
Yeah.
It happens, and not uncommonly. I've had a number of patients, respond to that. It's not everybody,
Right.
but it's enough where, and that's one of those side effects. When that happens, you are just scared to death. If you drove your kids to school,
Right.
and you have this, you don't even have a recollection of it.
Or you think you drove your kids to
You
school.
think you drove your kids to school?
But how did they sleep the night before?
They slept great.
Okay.
They said, it worked wonderfully.
Right.
But there's this side effect. The regular Ambien can sometimes not last a whole night, which is why the controlled release version came out. Insurance coverage is a little bit sketchy with it, but that'll carry you through a typical 7-8 hour sleep if you can get it. Intermezzo is actually really cool. And actually, it's one of the things I like most because a lot of people have not just trouble falling asleep, but staying asleep.
Right.
And they don't want to take a medicine every day because you build up a tolerance, even Ambien.
Yeah.
So what you'll do is you'll go to sleep. If you sleep the whole night, great. Let's say you get up at 2 in the morning, 3 in the morning. Well, you can't take an Ambien then because now your 8 hours are going to bring it to 11 a.m. So you need something just for a few hours. Intermezzo does that. Very effective. Actually, I found people taking that particular version of Zolpidem have been very satisfied. There's two sister drugs, not as common, Lunesta and Sonata. Sonata is not really in favor right now. Very few patients are on that. Lunesta is a nice alternative. Insurance coverage is a little bit sketchy with it. But those are those GABA receptor type medications. So that's the king of of that particular drug.
And you find like a lot of positive feedback from your patient population with that?
I do. For people with, and I'm sure Rob can attest to this, when you have bad insomnia, it's a life-altering problem. Yeah. So you want to try whatever you can.
Yeah.
So if it improves, if it doubles your sleep, so instead of sleeping 2-3 hours, you're sleeping 5 or 6, you're like, okay, that's not great, but that is better than what I had. Yeah. So you'll make that trade.
And any long-term side effects to not a particular drug, but all of this category of drugs?
Well, the problem, and there's some other categories which we could talk about in a little bit. The biggest problem is that drug-induced sleep like that is not quite the same as a natural sleep. The biggest effector is REM sleep. REM levels, when you talk about alcohol, when you talk about marijuana, when you talk about antihistamines, when you talk about Zolpidem, any benzodiazepines like temazepam, which we'll talk about actually in a moment, these things all have an effect on REM sleep. So there are some patients that, and this is a scientific fact, this is just how the drug works, that your sleep is not as restorative. You still get the benefits of your third stage of the non-REM sleep, if you remember us talking about that before. Right. But the REM sleep is affected. And it's interesting because what is the purpose of the REM sleep? Some people think it's actually with memory, just kind of like when you learn something, it kind of encapsulates in your head. I find when I'm learning lines, I'm learning. If I sleep and then try it again the next day, all of a sudden some things are like locked into place. You may lose some of that if you're just using medicines to sleep.
Right.
Yeah.
Gotcha.
Well, you mentioned marijuana. What about CBD oil?
Haven't seen any specific studies on that yet. I don't think it's as significant as marijuana when it comes to the sleep being fragmented.
Right.
Yeah, I heard marijuana's not good for sleep.
Well, the REM,
Right,
REM
right, it
part.
doesn't get
Because you
you
think about
down.
stimulants like caffeine, you have trouble going to sleep. So you're like, well, I won't take a stimulant. I'll take a depressant.
Right.
So I'll use alcohol, I'll use pot. It relaxes me. I go to sleep. But it affects this REM sleep. So it's not equivalent sleep.
Yeah.
Yeah.
Interesting.
And in fact, if you want to get into I don't remember from Michael Jackson.
Oh, well, he was doing like some.
Well, what
like
he did was he went. So there's a medicine called propofol.
That was like another level. Like,
Yeah.
That
Well, first was a
like-
cardiologist, a retired cardiologist, doing this. I don't know how qualified he was.
Yeah.
I think Michael Jackson said because no doctor would give propofol to sleep.
sleep.
This is what people use for surgery.
I was
for
going to say, it's like
anesthesia.
the pre-op.
So it just sinks you. Right. But an example, like
But
whatever.
when it puts you out when you're really
Yes,
in it.
I mean, like, and it's quick and it's like profound.
Yeah.
Sleep, but it's also obviously very dangerous. This is why you're basically intubated and monitored carefully.
Right.
The doctor didn't say so. Like, but you talk about like needing something pharmacological. I don't know what kind of sleep you get on propofol.
Oh my
But
god.
yeah,
Oh,
yeah.
So what was the Tanza?
Temazepam. So, I just mentioned earlier, 90% of people with mood disorders have insomnia. And of course, there's like a vice versa with that having insomnia, not sleeping, affects your mood. Well, a medicine that people use all the time for helping with anxiety is Xanax, Valium, Klonopin. These are short-acting, though. The one that's really used primarily for sleep is one called Restoril or Temazepam. It's a benzodiazepine like the rest of them are. You got to be a little bit, they're very effective, especially if you have an anxiety component to your sleeping. It works great. You build a tolerance up over time if you use it every single night. It has the same problem with REM sleep where it doesn't work quite as good. The other thing is, besides building up a tolerance, you actually can develop, you can have a problem if you mix it with alcohol where they're synergistically work uncontrolled, and you actually can build up a dependence or an addiction to it if you use it too much. So usually once a night you're okay, but people who use Xanax 2, 3, 4 times a day, like Valium, if you misuse temazepam or use it with other types of benzos like Xanax and Valium, you actually develop a dependence where if you don't take it, you actually will get like withdrawal from it. So it's actually, as much as I'm naysaying it, it actually works really good for someone who has an anxious insomnia. I've had some patients that love it, that take it 4 or 5 times in a week. It gets them sleep, especially like, let's say you have a big meeting. You have to go to sleep. You need that sleep that night.
Yeah.
Take it to temazepam, and they sleep well through the night. So it's it's got its place. Again, it's not perfect, but it's got its place.
So when someone comes to you and they say I have a holistic cure, or like do you encourage those patients to try it and see if it works, like where they won't be on pharmaceuticals?
Yeah, the first thing I always go for is sleep habits. Because I think Rob is educated with this because he's lived with it, obviously a professional guy, but a lot of people come in and they don't really understand what they're doing wrong or what happened. And sometimes just a couple of changes. It's almost like someone comes in with diabetes, people talk about medicine and insulin. But your diet and exercise is the most important thing.
Huge.
Same thing here. In fact, exercise uses up that ATP, actually helps you to, as well as with your brain, actually encourages sleep as well.
Yeah, maybe instead of working out in the morning,
Work out at night?
you should work out at night and like leave it all on the treadmill at night, like in 2 hours. But
You'll be exhausted.
you might be exhausted.
Just have the bed behind me at the end of the treadmill. I just fall over and crash.
What happens to me though is like, and I notice sometimes if I work out too late, I'm up now.
Right.
Yeah.
Yep.
I'm not like exhausted. You know what I mean?
Yes, because your heart rate
Your
and
heart
everything is
rate's
right.
ready to
I think
roll.
after an hour or two later, as you kind of like get the immediate effects down,
Yeah.
then it starts right.
Well, it's funny. Actually, in the last 3 months, life has gotten a lot better because I think I've acclimated myself to this new age of 50. And also the fact my son went through his first semester of college, and it's like, make that change. So it's actually been getting better. It's just, one of those things you want to make sure you don't have it come back. And it's kind of like, okay, so I look at my situation as more of like, I just got to live through it and kind of build into my new repertoire what I need to do to make sure it's going to be effective sleep in the future.
Yeah. It's almost like your margin of error has been cut down.
Yeah.
Now you have to focus on it.
Right.
To make sure, right? Before, like you could sleep on concrete.
Right,
when you were
right,
20,
yeah.
right.
Yeah.
You're at a party and you're at someone's couch. Like, no problem.
Exactly.
So basically, what sleep is it's a way for your brain to like recharge. Like I heard a doctor say that if we remember back in the day, they used to defrag your computer. So it would put like everything back where it's healing itself. It's doing all this work at nighttime. So it's critical for our brain function totally. And we don't even understand. 99% of us probably don't even understand everything that's going on at nighttime when we're trying to sleep. And that's why it's so important. The side effects are gigantic, huge, because our brain's not getting the rest it needs.
Yeah. Especially, there's, like I said, there's many different theories. The restorative part, of course, memory preservation. It seems, though, that science is moving towards this idea of the energy usage. A couple of interesting facts. So if you look at a baby is sleeping 14 to 17 hours a day, okay? By the time they're a toddler, it's down to 10 to 14, all right? 90% of the baby's brain growth has occurred in that first couple of years. As they become teenagers, it starts coming back down to 8 to 10. And now your growth is done and such. Now we go back to the, just our regular like sleep schedule,
Right.
7-8 hours typically until you get older. So it's almost as the brain has much more activity going on, that sleep is much more important. Also, if you look and you see the amount of a byproduct that occurs, so growth hormone is one of the hormones that's related during sleep time. That's helping with the restorative effects of it. But if you look at those byproducts, that adenosine from that ATP really accumulates a lot and is actually sublimated as you sleep. It's almost like you need to rest the muscle, because during the day, when does your brain rest?
Never.
Yeah.
Never. So what do you do with the byproducts? It needs time
Yeah.
to kind of reset things, and that's what they think sleep is really doing.
It's like a reboot.
Yeah.
Almost,
Yeah, exactly.
Okay.
Yeah.
Total reboot for the brain.
Bring it back to homeostasis.
So when, like, a person is having issues sleeping, at what point should they see a doctor and kind of get additional help? Be it like 3 nights, 4 nights? Is there a certain period of point?
Yeah. So my litmus test when patients come in, whether they're talking about anxiety, depression, back pain, insomnia, is it affecting your life?
Right.
Because someone say, yeah, I get anxious, but I'm fine. Well, yeah, my back hurts, but I take a couple Advil and I'm fine. When they tell me that they have an issue, it's affecting their lives adversely, especially when you start getting into things where it's affecting your mood, where you have trouble like driving or concentrating, it's affecting your work performance. It's time to do something. And in fact, a lot of times, if they say it is affecting them, but they don't want to do anything, I'm like, that's you're telling me you need to do something about it. So yeah.
All right, so my situation was never really affecting anything. It just didn't feel like restorative sleep was happening, and I was getting concerned, okay, is this going to get worse? But it never got to the point where it was affecting my daily situation.
But did it affect your energy level? Did it affect, did you feel fatigued?
Yeah, although remember it was kind of like, well, that one night was bad, 2.5 hours or 3 hours of sleep, but the next night it was like 7.
Right.
So it was fine. It was kind of like I almost said, okay, well, that's not great, but this night's good.
Right.
And I'm back into it.
Right.
So is that considered an issue? Or, I mean, it happens enough that I can't say for sure full week sleep's not going to be a problem.
Yeah. I mean, 2.5 hours, if you just use the numbers we used before, you're getting one cycle basically.
Yeah.
So that will definitely catch up to you. In fact, you're probably having a little bit of a sleep debt, as they call it, and you're catching up the next day.
Right.
I would probably suggest, I think long term, in fact, as good as you're doing, like, you may be doing better if you actually were sleeping. So
Right.
I probably would suggest, like, just physiologically, that won't necessarily work. Some people come in and say they sleep 4 or 5 hours.
Right.
Is that a problem? Well, they may get 3 cycles in that time, and that might be normal for them. So if that person said, I sleep 4 or 5 hours, but I feel pretty good, should I do something about it? I might say, no, you don't necessarily have to if that seems to be working for you.
Okay, so if I'm
But
like,
2.5 hours is on the short side, like,
no matter what.
that's one cycle.
Yeah.
Maybe partway through 2. That's not going to be enough.
So I'm clocking in 5.5 to 7 hours now, pretty much each night.
It's probably perfect.
Other than nights that are just bizarre because of just activity.
Yep.
So I mean that's probably, and it does feel like it's kind of back into a better rhythm.
Yep.
And maybe that's just living through the changes and kind of getting into the new rhythm type of thing. So
That sounds good, actually. That's actually not bad.
That's good.
So a couple of little fun facts, especially I know you guys are really into the nutrition.
Yeah, yeah.
Here's a little curveball to kind of just throw up. So if you look at someone who wants to sleep better, if they have a high carbohydrate diet, especially eating it late at night, it actually helps you to sleep better.
Right. I can see that.
Carbs are bad except for sleep.
Right. So that pasta dinner at
Yes.
7 o'clock and you go to bed at
Yes.
9, it's like,
The 10 o'clock pizza, you know what I mean? Leftover pizza. It's
like
sitting
you-
on a stove. That's
Right,
not bad,
right.
right? That's perfect. Cold, just eat it,
That's right.
then go to bed.
It's
Absolutely.
like you pick your poison.
Right,
perfect.
right.
Oh, my God. That's why it's been working.
So the
good,
acid reflux you would get from
Yeah.
that is a different
Oh yeah, all the other elements
Right,
are
right.
just as true.
Yeah.
And we even talked about with the intermittent fasting, one of the hallmarks of that is kind of picking a time like a 6 o'clock and not eating after that.
Yeah.
Except if you have insomnia, now I want you to eat.
Right.
You know, so you can't then you get fat and then you get sleep obstructive sleep
Right.
apnea. So
pick your poison.
Right, exactly.
You can't win. You can't win. You can't win. You can't win. So, do any of these sleep issues? Are there any? I'm not sure if I heard when I asked the fact instead of quoting the fact because my memory isn't what it used to be. So, does Alzheimer's or any of these type of things have correlate with lack of sleep through your life? Any sleep issues have to do with any of that they've found or no?
Not that I've seen. There are many other causes of dementia. There's Alzheimer's type and multi-infarct dementia. So if you want to extrapolate, if someone is not sleeping properly, they're increasing their cardiovascular risk and their circulation, which can lead to a multi-infarct dementia situation.
Okay.
But that's kind of a little 6 degrees of separation kind of thing. There's no direct correlation. There's many other things that are related to more dementia. And interesting, the use of the brain, like not reading, being retired.
Right.
You kind of slow down cognitively.
Yeah.
Doing things passively, like watching television, as opposed to people that are active socially, that are still working,
Right.
that are reading. Like these are things that actually do help prevent dementia onset.
Exercise the mind like a muscle.
Exactly.
That sounds like another podcast.
Oh.
Topic.
So,
So many
Dr.
topics.
Wierzbicki, what are you doing next?
Oh, that's good.
I think it's good. I think it's good. Any more questions, Rob?
Try to think. Naps. What would you any idea recommendation on naps in general if people are not just for insomnia but take them if you can?
Absolutely. In fact, earlier when we talked about culturally, the siesta associated with a 40% reduction in cardiovascular events. So it is absolutely, and people also feel, restorative a bit. Obviously, you're not going through a full sleep cycle if you take your power nap for 30 minutes.
Right.
But there is an effect in going through those early stages of sleep, even for a short period of time. Here's an interesting, little caveat to that. So, isn't it weird that we have a cycle of 24 hours? Like, I love the biology thing. I'm a biology major, obviously. So, isn't that coincidental? That's exactly what the Earth is, rotating every day, 24 hours. Yeah. So what if you took somebody out of their environment? Let's say you put them in a bunker.
Right.
Where there's no more, daylight or such to remember. So
a submarine, for example.
Yeah, absolutely. So your body has what they call a circadian rhythm. Yeah. Process C, as the more technical term is. And you'll find that the body will continue this cycle. There's an internal clock, really with the hypothalamus, the part of the brain, that is continuing this cycle that occurs. However, if you let time go by, you'll find that your sleep cycle actually will start to increase from the 24 hours when you're away from stimulus. What's interesting is as people are talking about exploring other planets, if you go to Mars, it's not 24 hours, it's a sol.
What is a sol? How many hours that we know yet? We do.
I know it's longer than an Earth day. I'm going to throw out 30 hours. I'm just trying to remember from the movie The Martian.
Right. Yeah. That's what I was thinking.
So I'm just going to throw that. Maybe in the ballpark.
Right. Don't type in the comments. We're trying to figure it out.
That's right. But when you think about it, though, as you talk about space travel, there's two. Everybody talks about the distance to get there and how you're going to breathe and the food and such. But two things you have to really deal with that is kind of clandestine. The one is radiation exposure. We don't have the magnetosphere of the Earth.
Right.
So the radiation exposure on Mars, even though it's farther from the sun, is significantly higher than here.
They don't have an atmosphere.
Yeah, exactly. Or the magnetic field.
Right.
That's protective. But the other part is physiologically what you do with sleep. Because now you're dealing if you're on a planet. Let's say you went there, it's 3 months later, and here you are on Mars. Well, how do you deal with a circadian rhythm of 24 hours on a planet that's a 30-hour day?
Yeah.
Right.
Yeah.
That actually, and of course, we're talking about sleep deprivation. Your body is completely, so they don't really know how you would adjust to that.
Hit the Google on how many hours is a day on.
So another thing, when we're doing this podcast right now, it's March 1st, I guess, right? And you hear about seasonal affective disorder and sunlight and things of that nature. So how does
Daylight
that play
savings
into?
time too, right?
Is that tonight?
No, it's next weekend.
Next weekend. Okay. Got a plan.
That's right.
So how does that affect sleep? Is there a correlation in how much sunlight you get during the day to what it does to your sleep situation?
So, sunlight helps convert vitamin D,
Right.
which is, there's many effects that vitamin D has neurologically as part of it. So no study specifically has put that together, but that's one way it helps.
Right.
Certainly sunlight during the day really firmly establishes your circadian rhythm.
Mm-hmm.
So for sure, if you're out in the sunlight during the day, absolutely helpful. Mood obviously is something a little more, more not necessarily physiologic, but there's also like a behavioral health component to it that it certainly helps.
Right.
But yes, then the contrast for when the night comes, it absolutely makes a difference where you're kind of tuning in your body.
Yeah.
In fact, one way to, like we talked about earlier, to mess up your circadian rhythm is to be kind of trying to sleep, all of a sudden get exposed to bright light, and now your body is like, oh,
Yeah.
what's going
What do I
on?
do? What do I do?
Exactly.
Yeah.
I remember being in Alaska, and it was like 10, 11 o'clock at night or something. We were there on a cruise, and the light was like, it was just, you felt like you were on a different planet.
Yes,
It's like
yes.
you've never experienced anything
Yes.
like that. You're so far up there. But I was, and then they have to adjust to the in the middle of winter when there's hardly any light. So I mean, it must be a unique environment to live in and try and
Yes.
figure all that out. But we get used to everything, you know what I mean? So we have an answer to the question.
Yeah, just to follow up, it's actually 24 hours and 40 minutes.
Wow.
Wow. So
Oh, it's just a
Not that
little
far
bit.
off.
Okay.
Yes, it's
Oh,
24 hours and
oh.
40 minutes.
I thought it was longer than that. Okay.
Yes, you love the Google.
Interesting. Yes.
So, all right. Well, I think we're about good here, Rob.
Yeah, this has been
This has
incredibly
been-
helpful.
We'd like to thank Dr. Wierzbicki for coming out today.
Hey,
Yes.
thank you for having me, guys.
Thank you very much,
Love
John.
talking with you. Love
No
your show.
problem. Well, this is the Help Me Out Middle Age podcast, and my name is Rob.
And I'm Rob too.
And if you really like what you heard today, it's very important that you hit the subscribe button, you hit the share button. That could really help us out because we're trying to grow the audience here. So scroll down below, hit the subscribe button, share on social media. If you found some value here, we would all really appreciate it. And we'll see you next time. Take care.